Hello, welcome to my student support system. In today's class, we will discuss a very important topic of childhood illness, that is hole in the heart. This class is in English, and if you want to study in Hindi, just click on I button. You will get link of the lecture in Hindi. You can also visit my channel, My Student Support System. So what is the hole in the heart? Hole in the heart is a congenital disorder which are of two types: atrial septal defect and ventricular septal defect. What are these defects? We will discuss them one by one. First is atrial septal defect. Every child is born with an opening between upper heart chambers. These are known as atrium. So these are upper heart chambers and these are lower heart chambers. So in upper heart chamber, normally there is hole so that blood in during infant fetal period directly goes from right atrium to left atrium. It is a normal fetal heart opening that allows blood to detour away from the lungs before birth. Because before birth, lungs are non-functioning. After birth, the opening is no longer needed and usually closes within several weeks or months. But sometimes the opening is larger than normal and does not close after birth, and this condition is known as atrial septal defect. What are the signs and symptoms of ASD? Sign and symptom of atrial septal defect depend upon the size of the hole. In some cases, symptoms of ASD may not occur until decades later. Some signs and symptoms that may occur include shortness of breath, especially when exercising, fatigue, swelling of the legs, feet and abdomen, heart palpitation or skipped heartbeats, atrial fibrillation, and heart murmur sound that can be heard on auscultation. Now, diagnostic investigations. For diagnostic investigation, physical examination is done where auscultation of the chest reveals murmur, heart sounds. Then echocardiography, chest X-ray, and cardiac catheterization for confirmation test. Treatment. If the opening is small, it does not make the heart or lung work harder. Means there is no problem. Surgery and other treatments may not be needed. Small ASD are discovered in infant often close or narrow on their own. There is not any medicine that will make ASD get smaller or close any faster than it might do naturally. Means it does not require treatment if the hole is small. However, if the ASD is large, it can be closed with open heart surgery or cardiac catheterization using a device inserted into the opening to plug it. Another defect that is also known as hole in the heart is known as ventricular septal defect. In this, the hole is in between the ventricles. There is an abnormal opening in the wall between main pumping chambers. Main pumping chambers are ventricles. The blood is shunted from left ventricle to right ventricle, which results in overloading of right ventricles. What are the signs and symptoms of this problem? Babies with ventricular septal defect may not have symptoms. However, if the hole is large, the baby often has symptoms related to heart failure. The most common symptoms include shortness of breath, fast breathing, labored breathing, paleness of the skin, heart murmur that can be heard on auscultation, tachycardia, that is fast heart rate, sweating while feeding, and frequent respiratory infections. Diagnostic investigations are same: physical examination, echocardiography, chest X-ray, and cardiac catheterization. What is the treatment of VSD? If the hole is small, no treatment may be needed, but the baby would be closely monitored by the healthcare provider. Babies with large ASD who have symptoms related to heart failure may need medicine to control the symptoms and also surgery to close the hole. Diuretic medicines are often used to relieve the symptoms of congestive heart failure. If symptoms continue, even with the medicine, surgery to close the defect with a patch is needed. Some ventricular septal defect can be closed with a special device during the cardiac catheterization, which avoids the need for surgery. This is called transcatheter closure of VSD. Nursing management. For both the problems, we need same type of nursing management. Observation of respiratory and cardiac status is very important nursing care in ASD and VSD. If signs of respiratory distress are noted, the children should be placed in semi-Fowler's position. All the medicines are given on time and parents are involved in the care. Intake output chart is maintained so that nutritional status and water balance is assessed. If surgery or catheterization procedure is scheduled, inform parents about the procedure and prepare them for surgery. Psychologically, anxiety level of the parents is assessed and psychological support is provided to alleviate anxiety. Vital signs are monitored even after surgery or catheterization procedure, such as heart rate, respiratory rate, temperature, BP, etc., and they are recorded. Surgical site care is provided with aseptic technique to prevent infection and promote healing. Other nursing interventions include all the nursing cares of a hospitalized child that we have discussed in the previous lecture under heading of nursing care of hospitalized child in the lecture Child Health Nursing. You can watch that lecture also by clicking on I button. You will get link of that lecture. Thank you for watching the video completely. Dear students, you can like my page, Facebook page, My Student Support System for latest updates. And for making your notes, visit my blog, mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and you can join Facebook group Nursing Notes. Thank you. Have a nice day.